Eczema is a chronic condition affecting millions of people in the UK, many of them children. And eczema can range from a mild annoyance to full hospitalisation. In this film, for Eczema Awareness Week, we'll meet the experts dealing with the condition and the people living with it every day. Talking 7 years that you've had eczema?
Yes, yeah, it's 7 to 8 years, yeah. I've been using confidently a cream which I've found out at this support meeting that it is not the right cream to use because it's got a cleansing agent.
But just sort of, as I got older, it was getting worse. Depends what I put on it. Yeah, I just got to be careful of what I put on, really. And just but I'm more in control of it now, so I didn't suffer, not as bad as my little one.
Yeah, she's got it worse.
She suffers it worse than what I ever did.
I usually get eczema at winter, and it's usually just on my arms and my legs. If it ever flared up during summer, I'd wear cardigans out. And everyone else was wearing like short tops, and they'd be like, "Why are you wearing a cardigan?" It's like, "Oh, you know, goes with my outfit." But I wouldn't take it out, and it'd be hot, it'd be sweaty, and then it'd make it worse.
Dr. Anthony Bewley is a consultant dermatologist and has been treating eczema patients for years.
Well, eczema is a very old term. It comes from the Greek, and it literally means to boil. And patients who have eczema feel that their skin is boiling and burning and bubbling away. So it's itchy, it's uncomfortable, it's red, it's nasty. For healthcare professionals, we need to be clear that there is a growing body of evidence about the genetics of atopic eczema. In particular, there's a gene called the filaggrin gene. Now, the filaggrin gene is a gene which codes for a particular protein within the skin, which has effects on maintaining the barrier function of the skin. And that's the essence of atopic eczema. It's a genetic condition which leads to abnormal barrier function of the skin. So for healthcare professionals, the most important thing is to try and re-establish the barrier function of the skin. We use good emollients onto the skin. We give good advice about how to use the emollients. In other words, frequently, swiftly, always going down, always going in the direction of the hair, never against the direction of the hair. We know that the moisturising creams are getting more and more like the oil our own skin produces.
Certainly one of the things that the doctors will say to us is that obviously they want a cream that's effective in managing the dry skin that can be associated with eczema. If the skin is compromised, it's important to apply lots of nutrition and lots of moisturising factors to the skin to restore the barrier function. The product contains niacinamide, which is an anti-inflammatory active ingredient which stops itching and which prevents the skin from itching. And obviously if you can restore the barrier function, the skin will progressively retain or regain a more normal condition.
I used to put her in a bath with oats in a muslin.
Oats?
Porridge oats, yeah. I seem to get all this advice.
You had some really bad advice over the years.
Like, yeah, so come on, let's give it a go.
Well, I think that the future for individuals who get atopic eczema, there are newer and emerging things which are going to be very useful. We know that pharmaceutical companies are trying to generate non-steroid anti-inflammatories. There are newer chemicals that can be used for atopic eczema, and these are called biologics. What is going to be interesting is gene therapy, so trying to find a way of trying to alter the genes. I think those kind of changes are going to be many decades off. The most important thing for parents or children or adults who get atopic eczema is to don't put up with it, don't live with it, seek help.